Well, thank you again for your time. And if you have any questions, don't hesitate to ask. If you want to stop the interview at any given stage, you can. And if you would like to skip any questions, just let me know and we can skip them. Okay? All right, so we'll start with the first part. If you don't mind telling me more or less how was your journey from graduation from vet school until you left clinical practice?
Sure. So in a working capacity, I started at a small animal clinic in Geelong, pretty much the day after I graduated. I went there a couple of weeks before for some introductory stuff. Started working officially when I had my graduation and had my certificate. So I was at North Geelong Vet Clinic for 7 years as an associate. For the first roughly 5 years, that also involved 1 in 7 after hours time as well, so roughly 1 in 7 weeknights or weekends.
Is that on call overnight?
On call, yeah. Okay. So with the mobile phone by your bedside, waiting for it to ring. And and then when the emergency clinic opened up, we didn't have after hours anymore. And then I left there when they changed owners 3 years ago, so end of 2014. And I was offered a position at Bellarine Veterinary Clinic pretty much straight away. So I had a break of 5 weeks and then started at Bellarine. During those 5 weeks I did a couple of shifts at the emergency clinic over Christmas, fill in the blanks, and then I worked at Bellarine as an associate in small animal clinics for for three years. Okay. Until I resigned and took up a PhD at Melbourne Uni.
Okay, excellent. So do you mind telling me a little bit more on what was your role in those practices?
Certainly. So the majority of the time was consulting, so vaccinations, sick animals, of dogs, cats, and I also did a little bit of birds and pocket pets as well. Then the remainder of the time, I would estimate probably about 25% was surgery shifts, so routine surgeries, desexings, dentals, lump removals. I didn't do a huge amount of what I would consider more involved procedures, so ex-laps. I didn't do any orthopedics. I'm not a surgeon. I didn't end up doing any administrative work or management work in any of the roles per se.
All right. So if you don't mind going a little bit more into detail of what activities were you doing, just pretend that I don't know anything about it. How did a day look like for you in small animal practice?
Sure. So the typical, the clinics that I worked at, often there was a vet that just did consultations, what we refer to as consultations. So that may involve vaccinating or preventative care of animals that are well and the owners want to keep them well, or it may involve animals that are brought in because they're unwell for whatever reason that the owners are concerned about. So for the sick animals, that's examining them, trying to get some information from the owners about what they've observed being amiss with the animals, and trying to then use that information and potentially other information gained from blood tests or other tests, x-rays, to get an idea of what's wrong with the animal so that we can make it feel better. And sometimes there's some degree of negotiation as diagnostic tests in and other procedures in animals not having any subsidies can extend what an owner's budget might be, but that's part and parcel of what we do.
Was the negotiations just about budget, or was there anything else that you recall?
The ones that's, for me, the majority of them were budgetary, but there are also times that it may be concerns but based on personal opinions or different individual or ethnic morals or opinions. So that, to me, would encompass the majority of the consultations. And as I said, some in the clinics that I worked, that could be all day. That was what you did. Then the other vet, if you were the other vet, then you would often spend the morning doing surgical procedures, which I mentioned before. That often encompass things like desexings, castrations, and spays of dogs and cats, or sometimes rats or rabbits, as well as removing lumps or other things we were suspicious of, or the dentistry procedures were a large. Feel like they were a large portion. I think the figures say that they're 5 to 10%. Yeah. So trying to clean teeth or also remove teeth that are too far gone, they're too rotten, or too diseased to be useful for the animal. That surgery role may also include taking x-rays, or I suppose we do some castings as well. We may also be doing other procedures like blood testings. And then for the most part that would be in the morning, and then you would consult in the afternoons. And then not so much at Bellarine because of the way that they're structured, but in the previous clinic there were also patients that needed to be admitted into hospital, so they required treatment in hospital, be it on a drip, or they needed medications to be administered, and you fitted that in around your consultations, whatever was booked in.
And then how did the after hours on call work?
So when I was doing them, we combined with, initially it was 2 other practices, and then another practice came on board. So it was, as I said before, most of the time there were 7 vets, so and we rotated through. So if you did a weekend, you didn't do a weekday, and 5 or 6 people did one of the weekdays. And so when the clinics closed, the answering machines left a mobile number that if you're concerned you would call them, and if you're on call, you're hopefully at the other end to give advice or to go into the clinic.
Right. Yeah. So what sort of activities do you find yourself doing when you were on call? Or you? Going from the assume I don't know anything. So the initial part was a consultation, essentially. Yeah. So again, examining the animal, taking histories. Some of them were, reaching back maybe 5 years, I feel like perhaps half of them were giving medications. Right. So they weren't unwell enough to require anything else on the spot. Other animals, I wanted to take blood from as soon as I could. So I either got my boyfriend at the point, or if the animal was bad enough, or badly behaved enough, ring around the nurses and see who was available. So you had the ability to get an assistant then? Yeah. Most of the time it was unofficial in my case, but sometimes they would, we would put them on a drip, and at times they, I think I did a cesarean. I'm not sure what else I did. Surgery wise. Bits and pieces. Remember endoscoping a dog to try and see if it had any stick left in its throat after it had caught one. I didn't ever end up having to do a GDV, thankfully. Ended up going somewhere else. Or having other decisions. Do you have the ability to refer now? When we were doing on call, the closest referral clinic was the emergency clinic at Werribee. So if someone was wishing to take that up as an option, and the patient was stable enough, or desperate enough, then we'd refer on to Werribee. I feel like that was a small portion. I know the stick dog went there. Besides the on-call bit, what... Or I'd call my boss. That was the other one. Sally! Fair enough. Do you find many differences between the 2 small animal practices that you worked at? No. The main thing is the way that the businesses are structured. So the actual work itself is very similar, and I guess I can only comment from the 2 clinics that I worked at as full-timer, but I found the